In this unit, we are going to be looking at a very important document in health promotion, still today, even though it was put together in 1986 at the first International Conference for Health Promotion held in Ottawa, here in Canada. This document is still relevant. It's still referenced up until today, and pretty much any health promotion class often starts with a conversation on the Ottawa Charter. So its original goal was health for all by 2000, and now it says health for all by 2000 and beyond. So health for all, hard to do. But the Ottawa Charter suggests kind of how to focus our efforts in health promotion so we can ensure that the most amount of people have the ability to enable themselves to be healthy, right? To have more control over their own health, which is the goal of health promotion. So this, actually, let me just work us through this, this model right here, this visual model right here, because this is what the Ottawa Charter looked like when it first came out. And one thing I do actually want to highlight is that it is in French and English, unsurprisingly, with our language laws here in Canada. But you'll notice that on the outside of this graphic right here is the word build healthy public policy, because that is foundational to all other efforts in health promotion. So this graphic also shows you the ways we go about doing health promotion, which is by strengthening community action, developing personal skills, creating a supportive environment, reorienting health services. Those are 4 of the 5 main action areas of the Ottawa Charter. The fifth one, and arguably the most important one, is building healthy public policy. And then this graphic also shows us our 3 ways of doing health promotion too, which is enable, mediate, and advocate. So in this lesson, I'm going to go through all these different parts of the Ottawa Charter. Okay, so I just kind of talked about these. This is shown a different way. Ottawa Charter, these are the 5 main action areas of the Ottawa Charter, whose goal is health for all, and whose goal isn't just to prevent disease or to treat people once they're already sick. It's also about helping people take control over their health now so they can live healthier lives now and into the future, although how they do that might change over their lifespan. Okay, so I wanted to start with building healthy public policy because, like I keep saying, this is feeds into all the other areas, and it's such a fundamental part of health promotion and public health and population health as well. So building healthy public policy is all about putting health on the agenda of policymakers, not just under Health Canada, but making sure that policymakers across the different sectors of government and higher level decision making and organizational units, they're not just thinking about outputs of their particular units, but they're also thinking about the health of the people that are in their unit and the health of the people that they have maybe influence over as well. So laws, like fiscal, economic measures, taxation, organizational change, these are all parts of healthy public policy. And when we talk about healthy public policy, we usually mean governments, but it could also be of an organization. So it could be of healthy public policy could also speak to the BC curriculum, K-12 curriculum, and what the policy measures are in there to help promote health across the education system in British Columbia. Here I have a picture of the Government of Canada's food guide. This is an example of how the Government of Canada have tried to implement some healthy public policy in part by nutrition recommendations, but they also, as part of the revamp to the food policy that took place around 2019 and a bit before and beyond, there was a lot about how do we change sodium laws and fortification laws and other things to help promote health across the population with respect to nutrition in that particular area. So like I said, and this matrix from your reading this week, from Middlemark this week, this document also shows you see healthy public policy at the top here. Healthy public policy is this overarching field of action. It influences everything else. And that's why, as I said in a previous video, it's hard to separate health promotion from politics totally. Because we need political investment, we need political capital, we need people that have influence to use that influence, not just for whatever goals they potentially have, but also to improve the health of their populations and the populations at large as well. Okay, so healthy public policy, that helps to inform those other action areas. And as I said earlier, what can help us do these things as well is enabling, mediating, and advocating, which I'll get back to in a bit. Okay, so I want to go over the last 4 action areas of the Ottawa Charter, one being creating supportive environments, which is a key part of what we call the socio-ecological approach to health. Like, all our behaviors and our lives take place in the settings we live, right? And if you go to university, you are part of a setting, not just the physical structure of the university, but also kind of the cultural setting of the university as well. And the settings we live in have an influence on our behavior, right? If you've ever traveled before, you'll notice that people have different health behaviors in different areas. And some of that is really about like the culture of that area, which has to do with the environment, but also the natural environment and the built environment as well. Right? So a lot of times we think of creating supportive environments and we think about like the natural environment, and this is a little bit of built environment in here as well, but it's also about like the cultural environment too. So this is an example from Simon Fraser University of how they're trying to create supportive environments that are focused more on inclusion and diversity and equity across the university as well. Okay, so that's also including in this creating supportive environments. It's not just about the physical environment. Okay. Another action area of the Ottawa Charter is strengthening community action. And to quote Middlemark here, this involves the empowerment of communities through strengthening social networks, building social capital, and building capacity for social change. How? By providing information, learning opportunities, and a broad range of resources. And a great example of an organization that is all about strengthening community action is something called Obesity Canada. Big fan of Obesity Canada. This was originally called the Canadian Obesity Network, and the original goals were a little bit more focused on like connecting people together to making sure that our ways of approaching obesity weren't just like siloed, as in like the doctors do it and then the dietitians do it and the, let's say, physical activity experts do it, and they all do it in their own way. But the Canadian Obesity Network is like, how do we all work together? How do we get our messaging kind of together? How do we create a group that can also be an advocacy group, right? So we don't just have a bunch of individuals trying to do something about obesity, but can we bring a lot of people together to help us have a stronger output? Okay, so that kind of speaks to this concept of strengthening community action. That said, a lot of people, when they think of health promotion, they just kind of focus on personal skills. And that is a part of health promotion, is like teaching people how to be healthier. But you notice that that hasn't been one of the first things I discussed. And it's not even like number one when it comes to the Ottawa Charter, right? We want people to eat more fiber. We want people to move more. We want people to ideally not smoke. We want people to have the personal skills that enable them to be healthier. But just educating and informing, it's part of it, but it's not all that's necessary for health promotion, right? But that's where a lot of health promotion efforts kind of get stuck. And so teaching people how to be active, telling people to be active and that it's good for them, but not having any walking trails, having, areas that are unsafe or poorly lit, or people not feeling like they're part of the community that can be active, right? What's the point of sending a message to be active if there aren't the structures and supports to allow a person to be active? So again, it's important to inform people about what's healthiest, right? But we need all these other supports to help people actually do it. And then the last action area of the Ottawa Charter is reorienting health services. And a main idea here is that in the past, especially pre-70s, a lot of health efforts weren't about health promotion. Health promotion is a fairly recent concept. Okay, it's been like in the works for some time, but a lot of our previous health efforts are all about about infectious disease control in the past, and then all about like disease treatment, or what we might call like the medical model of disease that we see on the screen here, right? That like someone's sick and then we fix it, right? That's the medical model of disease. Reorienting health services is like, okay, if we're going to spend money on health, let's not just spend money on helping people when they're already sick. Right? If we're going to spend money on health, can we reorient some of our efforts into more health promotion as opposed to disease treatment? Right? Can we create these supportive environments? Can we help people develop personal skills? How can we strengthen community action? And give resources to those areas and not just to disease treatment. So we put health promotion as an important part of our agenda for health too. Okay, so that speaks to a little bit more reorienting health services. Okay, and like I said, in the Ottawa Charter, they also talk about the main ways the main strategies, I should say, that we can use so we can do all those other 5 things. The 3 strategies that help us do those actions are advocate, enable, and mediate. Okay, so advocating is something I talked about in the introduction to health promotion videos, where I was talking about like we have to lobby, we have to advocate, we have to say like we want better, we have to like say, we have to fight for things, right? Advocating for change at various political and social levels. And you might not maybe feel empowered to do that like at the government level, but you can advocate for change within your own structures. Right? Within your workplace setting, within your home setting, within your school setting, within your friend group setting, you can advocate for change within your own sphere of influence. Another key part of the Ottawa Charter strategies for health promotion is the concept of enable. And I want you to think E for enable and E for equity. Enabling is really focused on equity. And there's a whole video that's coming up about health equity, but equity is more focused on not just giving everyone the same resources, but more accepting that not everyone has the same ability to access health and the same ability to get to certain health outcomes. What do we need to do to kind of level the playing field so everyone has the ability to have good health outcomes, right? Enabling, requires greater sensitivity to power relations involved in understanding the role of health literacy. We're not all starting on the same playing field. We didn't all have the same type of childhood. We didn't all start with the same basics. So how do we make it fair? That's part of what one of the strategies for the Ottawa Charter is. And then the last part of the Ottawa Charter, I like this one. This one took me a while to kind of understand, but mediating is about this isn't the job, health promotion isn't the job of one sector or one person, right? It's not just the job of the health sector, right? If we want to do health promotion, right? Let's say if we're trying to promote good nutrition choices, well, yeah, Health Canada has an influence in that, but what about the food industry and their role in that? Right? How do we mediate between different interests? Because we have all these different competing interests. How do we kind of find a place between that, bring interested parties together so we can help to have, again, more of these coordinated efforts towards health promotion that have a better chance of success? That said, it's important to realize that as wonderful as the Ottawa Charter is, and as wonderful as all our efforts in health promotion, our intentions are with respect to health promotion, I think this other quote by Son and Weiss is pretty good too, right? The dissonance between the promise and the reality has been the source of serious criticism. We don't always do health promotion well. And although the Ottawa Charter gives us this model of how to do it, we don't always do it well. A lot of health promotion is focused on short-term projects that maybe are not sustainable, that are not scalable, right? We often focus on health promotion projects that are just about education, just about building personal skills, and we're making it seem like it's only the individual's job. Health promotion is not just the individual's job, right? Health promotion is broader than that, right? We have to have the foundations that support people making healthy decisions. And again, a lot of our health promotion efforts are also focused on fighting disease or changing behavior, but it says here rather than economic or environmental change, right? Environmental change I've already talked about, but like you telling someone to go be active, but what if they like are working 4 jobs and are barely getting by in like life? And we're now asking them to spend an hour exercising a day or 30 minutes exercising a day when they're just trying to put food on the table for their particular family, right? The economic disparities are one of the greatest drivers for health disparities. One of the biggest reasons some people are healthy while other people's aren't is that some people have more money, some people have more access than other people. So as much as, I love health promotion and I think it's so important, it is hard to do and it involves intervention at various levels. It involves coordination, it involves advocacy, but it has a potential to do so much good. So that's a bit of an introduction into the Ottawa Charter. We will reference this document throughout the semester, and I will see you in the next unit.